can rest assured of your child's excellent performance when you register your child with Janan Schools, Bombo Karule Campus, and Kabalagala. Due to their firm educational background, we have the best facilities in both arts and sciences, fully updated to the latest sector standards, right from Senior 1 to Senior 6, in an environment that offers a chance to apply practical skills in all fields. That include a computer lab, introducing our students to the tech world, a well-organized science laboratory, a fully stocked library with all the essential books a student may need, a model farm to equip students with all the basic knowledge in agriculture, plus extra vocational skills. We promote co-curricular activities in sports like badminton, table tennis, basketball, volleyball, chess, and many more other activities. Register your child today at both campuses in Bombo Kalule and Kabalagala campus. For more information, contact us on the numbers below.
The Minister for Health, Dr. Jane Ruth Acheng, has called upon the public to take part in the preventive measures of reducing cancer. She was officiating at the Africa Test and Treat Initiative Conference against cancer and other non-communicable diseases.
Cancers can be prevented just by avoiding or at least reducing exposure to the risks. Some of them that we have just highlighted, you can't prevent. Incidentally, avoiding the 4 commonest risk factors of cancer, including cigarette smoking, and I am glad that all of you here in the room did not even smoke last night. Please try your best not to smoke again. Excessive alcohol intake, those who drink socially, 1 or 2 glasses of wine, please don't increase. Poor diet of junk foods, I know those ones are very tasty, try to avoid. And sedentary lifestyle. Let us all embrace physical activity to reduce the risks of all diseases that are non-communicable, like heart, diabetes, chronic respiratory diseases, which all share risk factors with cancer.
About 50% of all new cancer infections and 70% of the global infections occur in low and middle income countries, including Uganda, while about 9.6 million people die of cancer globally.
Ladies and gentlemen, you have heard, cancer is the 2nd highest cause of death in the world, just after cardiovascular diseases. In just 1 year, that is 2018 alone, 9.6 million people died from cancer, and over 18 million new cases occurred in the same year. Every day here in Uganda, we bury people who have lost their lives due to cancer, including the recent burial that rocked Uganda. About 50% of all new cancer cases and 70% of global cancer deaths occur in low and middle income countries such as Uganda. I'm sure many times many of you ask yourselves why the low and middle income countries have all the burden of diseases. But we can begin to change the narrative. It has been projected that up to 26 million new cancer cases will occur in 2030, causing 17 million deaths per year. And you may be a candidate. Whisper to your neighbor that please don't be a candidate. You know how to prevent it, so don't be a candidate. And that the burden of cancer in Africa will double by the same year, 2030. Uganda has minimal funding for cancer. We allocate barely enough money, about 52 billion. That is for non-wage. But if we add everything to Uganda Cancer Institute, it is only 114 billion, including wage and development. Very little money. It is a fraction of the resources that is required for effective treatment of cancer cases in the country. And as many of you are aware, and as you saw in Dr. Jackson's presentation, we have very limited facilities where people can go for care.
Acheng highlighted some of the government's intervention that will curb the high prevalence rates of cancer and NCDs in the country.
Our plans are to ensure that there is mandatory screening for prostatic surface antigen for males 40 years and above, and we are looking for ways of making it free of charge. So Chair, Parliamentary Committee and all the members, please look for the money so that our men can go and screen. Screen all women from age 25 and above for cancer of the cervix for early detection and treat to avoid complications. This one is already ongoing, and even for our HIV positive clients, it is free of charge. So take advantage and do it.
Dr. James Ochakan, the Senior Medical Officer in the Department of Non Communicable Diseases Prevention and Control, said the most common diseases are diabetes, chronic illnesses, and mental health illnesses.
The focus worldwide is on 5 non-communicable diseases. It is cardiovascular diseases, diabetes, chronic respiratory diseases, cancers, mental health conditions. Now, these conditions, why the focus is on them is because while non-communicable diseases could occur because of factors which we cannot control, like aging, like your genetics, your gender, there are common risk factors that we can modify. These risk factors that we can modify include tobacco. The use of tobacco, you can choose to smoke or not. You can choose to take alcohol or not. You can regulate your diet. Choose to eat healthier foods compared to unhealthy foods. And you can exercise. If you are inactive, you are at more risk of getting non-communicable diseases. When you exercise, you reduce that. So these common risk factors, these common non-communicable diseases has made the World Health Organization, the Ministry of Health, put a lot of effort on those diseases.
Kampala is the most highly affected district in Uganda, with about 5,664 cancer cases, followed by Gulu, Iganga, among others. Dr. Jackson Orem, the Executive Director, Uganda Cancer Institute, urged all stakeholders to have a multi-sectoral approach, focusing on the risk factors that cause cancer.
The answer is actually exactly what we are doing. Kampala has better diagnostic facility. It has better network in terms of access for health facilities, and that makes it really a place where cancer can easily be diagnosed, and that is the reason why the numbers are high. The other areas which are far off, the access to diagnosis may be a problem. So even if cancer may be there because of lack of access to diagnosis, it is very difficult to get figures from those places.
He said there is still a challenge of inadequate lab equipment that has hindered the proper diagnosis of cancer, something that needs urgent intervention.
This conference is about, we must advocate so that more facilities, especially laboratories and equipment, are actually procured, and that requires funding, and that funding government needs to look for.
Naguja Serena,